Thank you very much, Dan, for the kind introduction and also for the opportunity to speak as part of the Talking Point series. I'm going to divide today's talk up into a few different sections because this talk is a little bit different to what we often show at Talking Point. So I'm going to give some background into shift work, look at prevalence both across different jurisdictions and within different workforces. I'm going to talk about shift work disorder. So when we get to the disordered part of the spectrum, what actually is it? How do we measure it? And then I'm going to talk about a whole series of studies that have involved Monash and Turning Point researchers, really as part of international teams that have considered how shift work impacts a whole series of sleep, health, and performance outcomes. And there's three primary groups that we've worked with so far. So we're going to look at some police data, some firefighter data, and some nurse-related data. And finally, I'm going to finish with a bit of a project pitch, because I think this is an exciting area, as Dad pointed out, and I think there's a lot more that we can do within this space as well. So I'll finish with my pitch, hopefully have you all on board, thinking that this really is an exciting area. And I'll finish also with some opportunities to intervention, which are always quite popular. All right, so workers in many industries are increasingly engaged in irregular, rotating work schedules. This allows essential services to be provided at all hours of the day. And over the past decade or so, there's been a rapid rise in the number of people working what I'm going to call today non-traditional shifts, so outside the normal 9 to 5 workday. This slide shows really well a few key pieces of information. So first, if we look at Australia, we see that approximately 1 in 5 workers are classified as shift workers. Having said that, this is heavily dependent on the industry that you're based in. And the graph at the bottom of the slide shows that within the mining sectors, within hospitality, transport, and healthcare, probably most important to this particular group, have proportions that significantly exceed that 20%. This slide also shows some other useful information. So we've got Australia here, but plotted around the world map are prevalence figures from other jurisdictions. And these primarily come from market labour workforce data. You see that they're actually quite variable. We go anywhere from 15% in the United States through to more than double that in the neighbouring country, Canada. The reason for this, and one of the difficulties in assessing outcomes related to shift work, is that there's many variants. We've got overnight shifts, we've got rotating shifts, we've got evening shifts, and there's no consistent legal definition across those, other than to say outside normal working hours. So why do we need shift work? Well, it serves multiple purposes. It serves to maximise productivity. We can have trucks or freight or rail operating overnight. We can have factories open overnight. Emergency services, police, fire, paramedics, all needed 24/7. And one that we perhaps don't often think about, but equally important being in Australia, is that we're part of the global world. Financial transactions, markets, interactions all occur at hours across the day. Okay, this slide is very busy, and it's a brief introduction and overview into some circadian physiology. This also is going to serve as the basis for underlying why shift workers run into trouble, amongst other groups. So if we start with the box at the top, coloured in red, this is the two-process model of sleep-wake regulation. Along the x-axis of this graph, we have time of day, with dark coloured bars representing sleep periods in a normal adult. The first of the two processes is labelled here as S, process S. It's a homeostatic process that is totally dependent on the last time that you slept. In fact, what this graph shows here is that your pressure to sleep will build across the course of a normal day and is subsequently extinguished or diminished upon entering a sleep episode. The second process shown here is the circadian process, or process C, the body clock. This is independent of the last time that you've had a sleep, and it runs to an approximately 24-hour cycle. Together, these processes interact to determine how sleepy or alert you are at different times across the 24-hour day. The next box in green talks about entrainment of the circadian system, or the body clock. So the body clock is located within the suprachiasmatic nuclei, or SCN, of the hypothalamus in the brain. It entrains to the external environment, and it does this to make you more adaptive to environmental challenges that you face. The most potent synchronizer of your body clock by far are light signals. These are received via the novel photoreceptor in the eye, melanopsin, and transmitted directly to the body clock. Those signals are subsequently passed on, and the body clock regulates a whole series of physiological and behavioural rhythms. And I've put some examples of rhythms that follow a 24-hour rhythm in the box on the right here. One example of a physiological rhythm is that to do with melatonin. You'll notice that on all of these panels, again, we have clock time on the x-axis, and melatonin displays quite a profound circadian rhythm. In fact, levels are non-existent really during the day. They ramp up in the evening, and the peak or acrophase occurs overnight. Melatonin is subsequently broken down the next morning by light, and those levels rapidly drop. I mention melatonin because it has a special place within circadian physiology or measurement. In fact, we use it as an index of the body clock, if you like, to determine phase or what hands of the clock your particular body clock is at. A second example is respect, and this is an example of a behavioural rhythm, is with respect to alertness. So the fourth panel down here. You'll note that humans are much more alert during the day than we are during the evening. And I'm going to talk about the impact of this on how we make decisions later on. Also plotted on this particular panel are road traffic accidents. And you'll see almost a mirror image here where road traffic accidents are much higher in the evening or overnight period. And this, of course, has public health consequences, which I'm going to consider in a few slides' time. The final piece of information that's important in my 5-minute Circadian Physiology 101 course here is that circadian rhythms adapt slowly. They're not a fast process. So they adapt slowly to changes in sleep and or work schedules. Why is this important? It's important for a few reasons. First and foremost is that the majority of people who engage in shift work do not adapt to the shifted sleep-wake cycle that is required for their work. So circadian misalignment between those clocks and between those physiological and behavioural processes has been proposed as the mechanism that underlies poorer physical and mental health. And we're going to get into some of those consequences now. But I've got to say that first of all, I'd like to acknowledge a colleague who has helped me spruik up these slides because she gave quite a wonderful presentation a little while ago about using icons in talks. Now, when I went to search for an icon on the body clock, I was confronted with this, which ironically I thought was actually quite a good icon for the body clock, but you know, I think either way I've got to keep that one in there for years to come, I'd say. All right, so what are the consequences of circadian desynchrony? Really, what this slide shows is that there's many consequences. We can start talking about individual disease states, physical and mental health, decrements in performance, all the way through to those public safety concerns. The primary one, I think, being road traffic accidents, which I've touched on before. So let's have a look at some of these in greater detail. You'll see here that shift work is associated with increases in likelihood of obesity, type 2 diabetes, hypertension, and also cancer. So the World Health Organization now lists night shift work as a probable carcinogen. In addition to physical outcomes, there's also significant mental health outcomes, psychosocial ones. So we have increases in depression, anxiety, and feelings of social isolation. And this is something that I've worked with a few very smart people here in the audience to look at in one of the studies I'll present at the end, looking at isolation and what that means. Performance. This is getting on to an old study now, but it's a goodie. This it was a study conducted by Chris Landringham and colleagues where they looked at medical interns working either extended or overnight non-standard shifts. And they found that compared to when the same subjects were well rested on what they termed an intervention type schedule, where they didn't make interns do these wonderful heroic shifts, they were much more likely to make a serious diagnostic error, including medication error or serious medical error. Sounding really good if you're a patient admitted at night, isn't it? But in addition to that, they were much more likely to injure themselves, so they measured needle stick injuries, and to have significant deterioration in their cognitive performance. I say significant here because we're talking about less than 2 standard deviations away from their normal mean. So this is not a small impact. One study I think that helps put this performance decrement into context is one done by Australian researchers from South Australia, Drew Dawson and Katie Reid. They looked at the magnitude of performance impairment after a series of hours of wake, and they equated it to an equivalent BAC performance decrement. So this graph looks complicated, but what we have here along the x-axis is hours of wakefulness. On the left-hand y-axis, we have a mean relative index of performance. On this graph, higher numbers equate to better performance, lower numbers, poorer performance. And on the right-hand y-axis, we have that equivalent BAC outcome. Now you can see here that after we get to about 17 hours of wakefulness, performance has decreased. It's decreased significantly to around about 0.05 blood alcohol concentration. And this, of course, is not legal to drive in Victoria. Doesn't stop there, because you'll see that if we go to 24 hours along that particular timeline, we get to double that legal BAC limit, so 0.1. Something else stands out to me on this graph. You notice that we get the up kick in performance at that time. This is your circadian system kicking in. Remember I said there's the 2 processes and one of them is independent of the last sleep episode. If when you've been studying or working, you've pulled an all-nighter, you'll feel that second wind. This is the second wind kicking in. The other thing to note about this graph is that second wind kicking in never actually takes you back to baseline. In fact, you're still quite impaired. So second wind can help a little bit, but you're still not going to be as good as having a good night's sleep. So why do we care outside of the laboratory? Well, the graph here shows motor vehicle deaths by year in Australia, Encouragingly, since the 1970s, they've dropped significantly. Having said that, that very first marker on the graph is still representing 1,200 deaths, so by far still too many. And about 1 in 5 of those is estimated to be due to fatigue, to a massive cost to the community, both personal, social and economic. So much so that each state-based Road Accident Commission or TAC has active campaigns around fatigue. A really good one at the moment, and this is from the New South Wales jurisdiction, is about testing your tired self. And you can go on and do a series of tests, and you can actually compare how much your cognition, how much your decision making, memory and reaction time is impaired. Interesting to do before and after coffee, I've got to say. All right, so shift work disorder. What is it and how can we measure it? The graph on the left shows that there's numerous types of sleep disorders. It's not just, I can't sleep, doc, help. In fact, even more specific, here I've only plotted the circadian rhythm sleep disorders. They fall into 2 types. They can be intrinsic, or something happening normally to the body clock, or extrinsic, due to an external factor. This is where shift work disorder sits. It's due to the work schedule. The other one it's plotted next to is jet lag, and all being in Australia here, you've probably at some point in your lives had an experience of jet lag, or if not personally heard about it. For the more visual learners, I like text-based things, but I know that there's a lot of visual learners here. I've plotted what that looks like in terms of a sleep schedule compared to a normal adult who'd sleep 8 hours of consolidated sleep overnight. Third row down, we can talk about delayed sleep phase disorder. That's quite prevalent in adolescent groups. This is due to maturation in part of the body clock and all the related systems at this time. So teenagers, you're not just necessarily lazy, but there's a tendency with this disorder to want to stay up very late into the early morning hours and then want to sleep into lunchtime. And then, there's visual representations of all of those, and I'm happy to talk to you later about what they are. The second part of this slide really shows the major diagnostic groups for measuring shift work disorder. So there's 2. There's the International Classification of Sleep Disorders and the DSM, commonly used by psychologists. They state that shift work disorder is associated with insomnia. That's the ability to fall or remain asleep when attempting to do so, and excessive sleepiness when you need to be alert or productive. Now, the problem with this is that those symptoms are actually common to many sleep disorders, if not all, including ones not shown here, like obstructive sleep apnea. So really the first study I'm going to talk to you about is, well, what are we missing? What are other functional aspects of shift work disorder are we missing here? So this was a study that Monash heavily invested in. It was an international attempt to develop, assess and validate a screen for shift work disorder. We had about 300 people in clinics throughout the United States who completed a series of questions related to their sleep-wake behaviours. These questions came from standardised other tests at the time, from clinical nous and experience, and from a whole series of focus groups that we ran. In addition to this, we had physicians who were trained and accredited in sleep medicine assess shift workers to determine whether or not they had shift work disorder. And this is the clinical pathway that they used. From a whole series of questions that we had as part of this study, we're actually able to narrow it down to only 4 that were important in determining whether a shift worker had shift work disorder or not. And these are the 4 questions. Now, encouragingly for us, there was an insomnia-related question. There was a question related to excessive daytime sleepiness, so what we would expect based on those international classifications. In addition to that, 2 other items were important. One was related to well-being, and one, the propensity to doze, even after having some time off. So quite a functional and disastrous impact, really. So, where do we take this next? Next we went to, well, how prevalent are these in groups of shift workers? So this is a study involving both Turning Point researchers and those in the United States. And what we did was have a look at 2 big cohorts of shift workers. So more than 5,000 firefighters and 2,000 police took part in this study. This time I've colour-coded it. I should have colour-coded the last slide as well. But we'll see that symptoms of insomnia, symptoms of well-being and excessive sleepiness were actually very common amongst these groups. And these were high-functioning, high-performance groups. So next question, how do they cope? Well, there's a few ways that people cope. Given this is a talking point seminar and you're at Turning Point, somewhere along the lines drugs had to come into the picture. So this is where drugs enter the picture, because we had sort of hypotheses that people were going to use drugs in order to help them regulate when they needed to sleep or when they needed to be alert and vigilant at work. So the aims of the study, there were really 2: to characterise use of drugs in this cohort, and then to have a look at use of drugs and some outcomes. So there's some sleep-related outcomes there, there's some shift-related outcomes, and there's some performance-related outcomes, sort of mirroring what we'd expect from that background literature. With the big question being, can we predict poor outcomes based on drug use and shift work? In terms of use of drugs, it's actually much more prevalent than we thought. So about 1 in 5 was using a sleep-promoting drug. 1 in 20 reported using a wake-promoting drug in the last month. In addition to that, I can't go through all of the different categories today, but I'm going to focus on caffeine because I think it has a good story. Caffeine use, not surprisingly, was almost ubiquitous. Without the sample, more than 90% of our group used it. Worryingly though, almost a quarter were using it in what we'd consider quite high level. And we match this to US population data and trends in terms of use. All right, so here are some results. And I can't plot all of the outcomes for you without making the slide look tiny, but what I've got is 2 psychological related outcomes, stress and burnout, and 2 related to performance related outcomes, fatigue related errors made at work, in addition to near-miss crashes following a series of night shifts. And in each case, use of drugs was associated with poorer performance, as indicated by higher bars on each of these graphs, and that was the same for weight-promoting drugs as well. Interestingly enough, high doses of caffeine here were also associated with poorer outcomes. I'm going to talk about the importance of this in a minute. First, we wanted to try and disentangle some of these results a little bit more. So is it because they were engaged in shift work or was it because they were using drugs? Now, I plotted a series of those outcomes here on the left-hand side of the table and the relevant significant predictors to a series of hierarchical logistic regression models. While I don't want to get into the crux of exactly what those models measure, I think the important outcome is here, that both main effects, by main effects I mean either drug use or shift work itself, were important in predicting these outcomes, in addition to the interaction. So we have quite a complex story now to tell. So some discussion points, and perhaps I've said it more eloquently here in the written prose than in the oral delivery, but sleep-promoting and weight-promoting drugs in this study were independently associated with poorer health, got psychological ones here, and performance outcomes. Caffeine, and I said I wanted to talk about caffeine because it's often posited as a way to overcome those performance decrements while at work for shift workers. In fact, it's recommended by Sleep Health Foundation and a few other national bodies. And I tend to agree, as long as it's in low to moderate doses. I think once we hit high doses of caffeine, that there's detrimental health and performance impacts, probably because it's having a masking effect. So people consuming heroic doses of caffeine are probably struggling to keep up with their work-life balance. This is often me in the morning where I feel like I really need my coffee in order to get going, but perhaps that's a sign that something is not quite right, particularly if it happens over the long term. All right, so now I'm going to turn to a study that we did with nurses. This was based at Eastern Health, and I have some wonderful colleagues to acknowledge, including Doctors Lubman, Savage and Nissa Ferguson, who helped coordinate this study. It was funded by Movember as part of their Social Innovators Challenge. And really they were seeking creative and innovative ideas to strengthen the social connections of men. And if you remember back to one of the introductory slides, I talked about this idea of shift work being isolating. So it can be debilitating on a social front in addition to those physical and psychological impacts. Given this is a Movember project, you'll see that some of the results are focused or geared towards men, and I'll point out when that's the case. Although we did collect data from all genders, and so when that's the case, I'll point that out as well. So why nurses? So we've talked a lot about police, we've talked a lot about firefighters. I showed you some data from medical interns. Well, I think really the top bullet point and the bottom bullet point here go to the crux of the issue. So a very high proportion of nurses work shifts, and really, as a group, they are responsible for patient care around the clock, unlike any other medical profession. This is important given that poor decisions at one particular time can really impact upon patient recovery and care. To date, the majority of studies in the field have focused on health outcomes, particularly of individuals. There's been less examination of what nurses perceive as the biggest challenges around shift work, and what barriers and facilitators are there in order to engage or stop them from engaging in healthy behaviours. There's also, I think, been less examination of opportunities for intervention, not only at individual but also at organisational levels. And so this is what we're really interested in this particular study. The study had two components. The first being a workforce survey, which was emailed to Eastern Health employees. We had quite a reasonable uptake, including a high number of shift workers again. Following on from that, we coordinated and ran a co-design workshop where really we wanted to understand the impacts of shift work from a group of male shift workers and NUMs in their own words, and identify how to engage them in opportunities based on their wishes. In terms of some demographic and also some results from this study, the workforce was as expected. High proportion of females, interestingly enough, very experienced. So about 50% of the sample had been in their job for at least 5 years. They had poorer outcomes on some drug and alcohol measures, including the Audit C, which is a measure of alcohol consumption. They had poorer outcomes on a series of mood, psychological distress and well-being related outcomes, including the case 6, which I've put here. And in addition to that, the males in the sample reported poorer outcomes, particularly on alcohol and other drug, such as smoking use, and health and well-being outcomes. So perhaps Movember they knew something was here within this group, even though that male nurses make up the smaller proportion of the sample. This slide shows in the blue hand tables the type of shifts and then the frequency of shifts that our group was engaged in, and you'll see that they're very varied. We'll talk about the impact of that at the end. In addition to this, in the red, we ask people that, well, when you're working night shifts, how much is your sleep and performance degraded when compared with others? People were very candid here. In fact, we've got more than 40% saying that it was actually slightly or much more affected. And we wanted to unpack this a little bit more. So I have a whole series of colourful slides following this one to unpack it. But we asked people, how has shift work impacted on your overall well-being? You'll see that the majority of statements made, 80%, were negative. Perhaps somewhat surprisingly, there was still a proportion of positive outcomes or impacts. So let's talk about the negative aspects or impacts first. I've tried to colour code these so that they fit within themes. So if we start within the blue circles, we'll see that those 3 pillars of good health, as sort of coordinated and assessed by the NHMRC, were quite high up. So sleep, diet and exercise. And I'm going to show you on the following few slides what that looks like in terms of in shift workers' own words. In addition to that, social impacts were frequently highlighted as a negative aspect. We then have the red coloured balls, perhaps not surprisingly that mood, health, well-being were also affected. Conversely, we can look at some positive aspects associated with shift work. So these were a lot less. Primarily, they're around flexibility. In addition to that, and I think one quite interesting finding, is that you'll note that some of the impacts that I showed you on the last slide in terms of negative, so sleep and social, also appear on this slide. To a smaller degree, but they appear nonetheless. There is a little caveat to this though, which I think will become clear when I show you the exact words of shift workers. So here's some examples of negative impacts. And you'll see that these things are often quite entangled. They're not necessarily separate. So the first example in black font, highlighted in red, talks about mood. It talks about a sleep-related impact. It talks about eating foods high in fat and sugar. It talks about problems with exercise and opportunities to socialise. So that really encompasses in a whole package all of those things all in one. In terms of isolation, and this was an interesting finding, so shift work being emotionally isolating from both 9-to-5 workers, from family, and even on public holidays. So because there's a tendency when you can sleep to get it, so even if that's when your family and friends are able to have fun, if you're sleeping, obviously it makes it much harder to join in. The positive examples. And here, again, I've got to point out my use of icons because I've picked something that's mostly positive, but not fully positive. And I think this is the caveat that I was talking about, because what you realise is that there are some positive impacts that people were highlighting with respect to shift work. However, it was rare for them to appear without also a negative impact. And the first statement shows that quite well. So some positive aspects of shift work are being able to do things when the crowd's not there. So visit banks, visit post offices, whatever it is. However, and there's always a however statement, the tiredness comes. from varied shift hours contributes to, again, poor eating habits and an inability to exercise consistently. The second particular statement goes a little bit more into this idea of social disconnectedness or isolation. Because you see here that the positive element being easy to catch up with other nursing friends, the detrimental impact was harder to catch up with anyone else. And this particular shift work nurse said they've lost friends because of this, so quite an emotional experience to this negative outcome. All right, so the last part of the talk is going to look at, well, what opportunities do we have to intervene? And I'm going to come to this pyramid, which really has those three pillars of good health. So exercise, diet, and sleep. So as a team, we decided that this would be a really good way in order to articulate and be able to test an intervention. We chose this for a few reasons, but primarily because those impacts never occurred in isolation. They were always entangled. So I thought it important to pitch an intervention which addressed all of them. We also wanted to know what people wanted and how they wanted it. So we asked shift workers, what would make it easier? And you'll see some of the top responses here. Offerings that fit with my schedule, flexibility, or importantly, not having to commit. So people wanted to engage in group activities. They wanted to engage in sports or even social walking groups, what have you, but have this flexibility that they didn't have to commit to every week, because that was not always possible. Had to be low cost or free, and again, an item to do with this socialisation aspect, having others in order to push you along. So we ran a co-design workshop, and I'm more a quantitative researcher rather than a qualitative researcher, but what I've learned is co-design workshops really mean that there's lots of little pieces of paper and sticky notes that get plastered around the room, or butcher's paper with old texters on there. In addition to that, co-design workshops allow you to have a really good discussion and workshop ideas in order, to bring them to fruition. So we had a whole series of ideas bandied about here. Again, this workshop, it was facilitated and funded by Movember, so it was targeted towards men. I think this quote from the workshop really sums up exactly what we were trying to achieve. So a group-based exercise, a vehicle to get active that was allowable for personal goals. People wanted others around, not necessarily to compete. They wanted to compete against themselves, but they wanted that social support. They wanted a program that actually considered the stresses and pressures of shift work, while also doing something good for health. And again, this idea, it keeps coming up and up and up, but getting together before work in order to play. Hence the title, I think, of the talk, Shift Work Play. Let's talk about other opportunities for intervention, and these, rather than being on the organisational level like that pitch I just showed you, are more geared towards the individual. So this article was published in BMJ last year and includes a really helpful infographic with dealing with night shifts, and this is freely available. You can search for this or go online and download it. If you can't find it, please write to me and I'll send you a copy, but it really recommends doing exactly all of the things that we've discussed throughout this talk. Before starting on night shifts, important to minimise a sleep debt. While doing those shifts, important to improve performance, and they recommend a combination of diet, exercises, but also extra checks, given that there can be those performance decrements. And following a series of night shifts, to try and establish that normal circadian rhythm as quickly as possible. Again, a combination of factors is recommended: sleep schedules, diet, exercise, use of drugs if needed, and avoiding light at the wrong times. This work really represents a whole body of studies, and many people have been involved, so I'd like to acknowledge their contribution, both here at Monash and Eastern Health and overseas in the United States, and also to acknowledge the funders who've been very supportive of each of these particular pieces of work. I think with that I'll close the session and thank you very much for listening. I'm happy to take a couple of questions, but I'm also happy to stick around if you prefer to ask me not in the public forum. So thank you for listening.